All right, so let's peel back the curtain on something we've all experienced, but maybe don't fully understand. Those first few minutes of a doctor's visit, before you even see the doctor. We're going to break down exactly what's happening and reveal the secrets hidden inside your vital signs.
So, have you ever really thought about that? What is a nurse or a doctor actually learning about you in those first 5 minutes? Because it's a lot. It's not just random checks, it's like they're reading the first chapter of a very detailed story about your health. So come on, let's follow along on this journey and figure out what it all means.
Okay, first stop on our tour, the basics. Height and weight. I know, it seems almost too simple, right? But these numbers are incredibly important. They create a baseline, kind of like a starting point on a map for your health, and everything else is compared against it.
So why all the fuss about these two simple numbers? Well, it's about way more than just the number on the scale. Think about it. For kids, it's all about making sure they're growing properly. For us adults, losing a little height could actually be a red flag for osteoporosis. And a sudden jump in weight, that could mean your body is retaining fluid, which might point to heart or kidney trouble. And, this is a big one, your weight is absolutely critical for figuring out the right dose of many medications.
And you know that old school balance beam scale? It's actually a pretty cool piece of engineering. Here's how it works. First, they slide that big bottom weight into the right 50-pound slot to get close. Then, they take that smaller weight on top and slide it very carefully until the whole beam just floats, perfectly balanced. That's how they dial in your exact weight.
Now, once they have your height and weight, they often calculate something called your body mass index, or BMI. Basically, it's just a simple formula that uses those two numbers to see if you're in a healthy weight range for your height. Now, look, it's not to be all and end all, it's not perfect for everybody, but it gives doctors a standardized place to start the conversation about your health.
All right, let's keep going. Next up is your body temperature. And this whole system is managed by this tiny but super powerful command center inside your brain.
Yep, that command center is called the hypothalamus. Just think of it like the thermostat in your house. It's constantly checking in, getting too warm, it kicks on the AC by making you sweat. Feeling a chill, it cranks up the heat by making you shiver. It's this amazing, non-stop balancing act that keeps your body running just right.
But here's a cool fact that most people get wrong. That whole 98.6 degrees thing, that's not a universal number. That's specifically for a temperature taken in your mouth. If you measure under your arm, it's usually about a degree cooler. And if you use a rectal or forehead thermometer, it's often a degree warmer, just because it's closer to your body's core heat.
And of course, these days, you're more likely to see one of these high-tech gadgets. The one that goes in your ear, that's a tympanic thermometer. It's crazy fast, but you've got to get a really good seal for it to be accurate. Earwax can even throw it off. The one they swipe across your forehead is called a temporal scanner. Also super quick and easy, but it needs clean, dry skin, so, no hair or hats in the way.
Okay, moving on. Let's talk about the rhythm of your heart, your pulse. And really, it's so much more than just a number. It's the beat of your life, and it tells the story of how hard your heart is working, minute by minute.
So what exactly is a pulse? Well, think of it this way. Every single time your heart beats, it shoots a powerful wave of blood into your arteries. When you feel your pulse, what you're actually feeling is the wall of that artery stretching out and snapping back as that wave of blood rushes past.
And you can feel this little wave in a few key spots where your arteries are close to the surface. The one you probably know best is on your wrist. That's the radial artery. But in an emergency, you'll see first responders go for the carotid artery in the neck because it's a stronger pulse. Doctors might even check one on top of your foot to see how good the circulation is all the way down there.
So, what's considered normal? For most of us adults, when we're just sitting around not exercising, our heart rate should be somewhere between 60 and 100 beats a minute. You can think of that as your heart's perfect cruising speed.
Now, if your resting heart rate is consistently outside that range, it gets a special name. If it's too fast, so over 100, that's called tachycardia. If it's too slow, under 60, that's bradycardia. But here's the interesting part. Having a slow heart rate, bradycardia, can actually be a good thing. For really fit athletes, it's often a sign of a very strong, efficient heart. Okay, from the heart, let's move right next door to the lungs and talk about your breathing. This is maybe the most subtle vital sign they check, and there's a very clever reason they're so secretive about it.
First, let's just get the numbers down. A typical adult, just chilling out, takes somewhere between 12 and 20 breaths every minute. And remember, one full breath is breathing in, and then breathing all the way out.
And here's the trick.
You know how the nurse or medical assistant keeps their fingers on your wrist like they're still taking your pulse? Well, they're not. They've already got your pulse. Now they're sneakily watching your chest rise and fall to count your breaths. Why? Because the second you know someone is watching you breathe, you start breathing weirdly. This little bit of misdirection is how they get a true and natural count.
All right, let's tackle the big one. The one that can be kind of confusing for a lot of people, blood pressure. You know the drill. The cuff gets tight on your arm, you hear a little whooshing sound, and then you're given two numbers. So, what on earth do those numbers actually mean? Let's break it down nice and simple.
Okay, here's the easiest way to think about it. The top number, that's called systolic, is the pressure in your arteries when your heart beats. It's the maximum force. The bottom number, diastolic, is the pressure when your heart rests between those beats. So just remember, it's always the pressure during the beat over the pressure during the rest.
So your reading falls into one of these categories. Normal is great. That's anything less than 120/80. If that top number is between 120 and 129, you're in the elevated category. It's a heads up. After that, you get into the stages of hypertension, which is the medical term for high blood pressure. And notice this. For hypertension, it says or. That's super important. It means if either your top number or your bottom number is in that high range, it counts.
So, thinking back to your last checkup, do you remember your numbers? Knowing where you land on this chart is honestly one of the most powerful things you can do for your heart health.
And that really brings us to the main point of all this. None of these things, not your weight, not your temperature, not your blood pressure, are just random numbers. They're called vital signs for a reason. Together, they create this amazing real-time snapshot of how your body's most important systems are doing.
So, let's put the whole story together. Your temperature, that tells us how well your brain's internal thermostat is doing its job. Your pulse, that's the chapter about your heart's speed and rhythm. Your breathing rate clues us in on how well your lungs are working. And finally, blood pressure gives us a direct report on the health of your heart and your arteries.
See, each of these vital signs tells a part of a larger story. And when you understand what they mean, you're not just a patient anymore. You're an active participant in your own health. So the next time you're at the doctor's office, listen closely. Your vitals are talking. What story are they telling you?